Yeah. First difficult exercise of the day is to share my screen. So I'm just going to make sure I've got the right one in front of me. Great. Okay. Hopefully you can all see that. Lovely. So yeah, as Doron mentioned, I'm based at the Evidence-Based Practice Unit, which is it's an academic unit that does very applied research, and it kind of brings together my two other roles, which is I have one foot in academia with being a professor at UCL in children's mental health and wellbeing, but I'm also a director at the Anna Freud Centre, which is a child mental health charity. So I hope what that means is that the research we do is quite practical in its focus. We try to apply a sort of so what principle, which means that really anything that we're looking at ought to have some kind of practical implications or applications that mean it's useful for those working directly with children and young people. And so it's really from that perspective I come, I suppose. So what I'm going to cover is I want to spend quite a bit of time on the background, thinking about what we know about children and young people's mental health and well-being. And I guess if you've been to some of the other seminars this week, you might have a sense of that, or that might be your background anyway. But also want to spend quite a bit of time thinking about risk and protective factors, which probably some of that won't be new, but I think it's so important to keep it in mind when we're thinking about interventions and support in school. Quite often we sort of forget that context when we think about what an intervention ought to look like. So I want to bring that to the fore. And then I will describe a bit of what we know from the evidence base around what works in schools and give one example of an ongoing piece of work. But I also want to draw attention to that wider school system and why intervention is really only a small part, in fact, of that sort of much bigger picture of support in school. And then I'll have a bit of a thought about what I think we should be doing next research-wise. So just as orientation, go back a few years now, we spent a lot of time in the field talking about 1 in 10 children and young people experiencing mental health problems. And that was because for a long time, we didn't have any good prevalence data in the UK around what was the sort of extent of mental health problems. So we were relying on data that came from sort of 10 years ago. And that was our sort of rule of thumb. And I tend to think of this because I do a lot of school-based research and what that means from a sort of broadly a class in a class. So not all classes are of 30, but that's 3 people in your average class. We've had a bit of an update on that data in recent years, and what we've found is over that period there's been some increase in mental health problems, so that figure was then updated to say it was around 1 in 8 children and young people actually experiencing mental health problems, but really noticing that was mostly driven, that increase, by the older adolescents, and there being real struggles particularly for young women in that group. And them having more like sort of 1 in 4 experiencing mental health problems, particularly anxiety and depression. But interestingly, what they collected alongside that data was information about where young people go for help. And of those scoring above those quite significant clinical thresholds, they found that it was only around about 1 in 4 who were in contact with specialist mental health services. But interestingly, around about double that would actually seek help from teachers. So I think that tells us something really interesting about where young people go for support. And quite often they will seek it from the trusted people that they have in their immediate environment. And often that sort of external help is much harder to access or may not feel like it suits them. Obviously, we've had recent data from the COVID period, which has told us a little bit more about what mental health has looked like in the last couple of years. So last year we had data that told us that 1 in 8 had increased again to 1 in 6. So 1 in 6 children and young people experiencing mental health problems. And in fact, a couple of weeks ago, we had an update on that data. And in spite of the fact that lockdowns are receding and children and young people are back in school much more, that 1 in 6 is quite stubbornly staying at that rate. What else we've seen in the same time is also a sense that happiness has been on a decline. And some of that might be COVID related, but actually the Children's Society were reporting a 10-year trend of decreasing well-being over that period. So it's not just about COVID, it's about other things too. So I suppose that begs the question, what do we think, therefore, might have happened in this recent sort of history for children and young people that is making those rates go in the direction we really don't want it to? So I think the first thing that comes up when this is ever discussed in the news is social media. And yes, there is evidence to suggest that social media does play a role. But when we talk to young people about it, they give a much more nuanced perspective of the role of social media in their mental health. They talk about it sometimes being detrimental. They talk about online bullying, or that sometimes it doesn't give them a great self-perception and so on. But they also talk about it as being a source of support. And I think it's really interesting that during the lockdowns, we saw secondary school age young people faring a bit better actually in terms of their connections than the primary school group did. And I do wonder if some of that is to do with the fact that they've been able to use social media to maintain those links, those friendship groups. So that one's complicated. We also hear this a lot from young people, that they feel anxious about the future. They feel worried about climate change, and they feel quite angry about it too. So it seems like it's quite far off, but it is actually a major concern for many children and young people. We also know the relationship between mental health and poverty, and that austerity has been something that we've been, certainly in the UK, has been sort of a way of managing economics for the country for quite some time. In England, we've had lots of cuts to sort of education funding and so on, and a real sense that that's bedded in over the COVID period. So more young people in poverty than before. And that, of course, comes with a whole range of challenges to pressures on families and also, available resources. But I suppose not to forget as well that there are some features of the school environment that have changed in recent years, and we definitely get reports from young people about school being a stressful environment going up. So within England, there have been studies that have shown that things have been eroded in terms of free time for children and young people to decompress. So certainly in terms of their own free time outside school, that seems to have reduced, and they're being funneled much more into very focused activities. But also break times within schools are much shorter than they used to be, almost an hour a day less than maybe 10 years ago. And also more significant academic pressures, lots of high stakes testing, and feeling like school is the absolute be all and end all for, you have to get this right now, or, the implications for later life are sort of considerable. And of course, there's been the period of the pandemic, which has been particularly challenging. I want to slightly change tack and think about this a different way. So I've talked about prevalence of mental health problems, and a lot of my focus will be on that. But one of the things that I've been quite interested in is a slightly different way of thinking about how mental health problems are experienced. And I know we can't really discuss, but I've put up here, this is 100 people across the screen, 17 are shaded, and it's a statistic to do with mental health. So maybe just have a think to yourself for a minute about what you think this statistic might be. I was actually talking to a group about this the other day, and they had some thoughts about whether it might be those who actually identify themselves as saying, yes, I see myself as having a mental health problem, or is it about the proportion who might feel like they're getting the help they need with their mental health problems. You might have other thoughts on what it represents. So what it actually is it's the proportion of people who across the life course don't have any experience of mental disorder. So this is based on a quite famous longitudinal study that many of you may have heard of, called the Deighton Longitudinal Study. And Schaefer in 2017 carried out a study where they were interested to see, with this long cohort that they have from sort of childhood, slightly later in childhood maybe, through to late adulthood, through all the sweeps of survey data collection, how many people didn't score above those sort of clinical thresholds at any sweep. And what they found was it was a really low proportion, 17%. So I'm really taken with this as a public health message, essentially, because I think it does two things for me. It, one, normalizes the experience of having mental health problems. So for young people, it's really important. Schools, we set the norms, don't we? We give them the expectations about what the outside world is like. So the message here is, if you're experiencing a mental health problem, you're in the majority, actually. You're not a minority. You might be at this point in time, but other people, if they're not experiencing one, may have done previously or may do in future. So you're in the majority. The second message is, if you haven't experienced a mental health problem, at some point in your life is probably going to get challenging. And there will be times when that really threatens your mental health. So it makes sense to equip yourselves with the skills and the support systems to be able to manage those knocks when they come your way. The other thing we were quite interested, having seen this study, I thought, well, that's really fascinating. But the study really only started sort of midway through childhood. So we thought, well, what we could look at this actually in a child data set. So we looked at the Millennium Cohort Study, which is one of our bigger British cohorts. And we said, well, can we see the same thing? How can we determine the enduring mental health of children and young people? So we looked at from birth through to 15. And we said, well, okay, who in that period doesn't have any sweeps where they score above thresholds? And what we found was actually that even in that much narrower period of life between birth and the age of 14, there were less than 50% of children and young people who had enduring mental health, so who hadn't scored above that threshold at any one time point. So even by the time they get to that age, even before they finish secondary school, if they've experienced a mental health problem at some point, they're already in the majority. So before I go on to that, so that's just, I suppose, a few different ways of conceptualizing mental health problems and how we think about them. I suppose the other bit is about what increases the likelihood that we're going to experience mental health problems. So, and I talked about in a class of 30, how many young people on average might we expect to experience problems, but of course that is an average. And we can say, okay, in a class of 30, we might expect 4 or maybe 5 based on recent data. But we know that there are lots of different drivers for mental health problems, and some of those will be based on concentration of deprivation and other adverse experiences and higher concentrations within a school of special educational needs, for example, other things. So that picture will change school by school depending on their pupil populations. And some schools will have, a much bigger proportion of children and people experiencing challenges. So the question becomes, okay, can we think a bit more about what those challenges are? And because these are quite well known, rather than just list the risk factors, which you probably may well be familiar with, I thought it might be better to put this in the words of young people themselves. We carried out a study, well, actually, it's still ongoing, but it's been going on for 5 years, where we follow around about 80 young people, and they've been selected from across England, and particularly to represent young people who have more struggles than your average young person potentially. So they might be living in particularly difficult circumstances in one way or the other, or they may have been experiencing mental health problems. So a bit of a mixture, but definitely those who might encounter challenges more commonly. And we've been talking to them about what their experience has been about when things threaten their mental health and well-being, and how they experience that and how they manage it. So just to give a bit of a tour of some of those risk factors, I'm not going to read out these quotes, but I just think the young people's words themselves illustrate so much better than I could say it, how those risk factors are experienced. So this one is about feeling like you're living in an unsafe or violent neighbourhood, essentially. Okay. The next one is about sort of poverty and deprivation. So I think, again, it's a bit like the climate one. We often feel like this is just the wider backdrop for children and young people. But from this quote and from some of the other discussions with young people, you can see that they really feel this directly. So they see that the pressure that having money struggles puts on the family, and they worry about what it means for them and for their family. This one's about conflict in the home. So that could be conflict between parents and children, but also conflict between parents that children might witness, and what that makes them feel in terms of, you know, feelings of threat, but also possibly blaming themselves for those conflicts. This one's about abuse within the home. So this young person's experiencing the first time they were on the receiving end of that from one of their parents. This one is a young person whose parent has a mental health problem herself, and you know, and sort of the worry she has really about her parent. And this one's about bullying, which we know is quite common, but actually when we look at the impact that it has on children's mental health, it's really up there with all of those other, what we consider adverse childhood experiences like domestic abuse, for example, in terms of its impact. And then I've run out of space for quotes here, but I just want to name a couple of others. This is by no means exhaustive, but we definitely see a higher concentration of mental health problems for children with special educational needs. I think there's a complex reason for that, probably. So some of that might be about underlying challenges which are related to both special educational needs and mental health. But also there's definitely a sense that those young people sometimes feel isolated or lonely, or can experience stigma and bullying as well, which of course increase the likelihood of mental health problems. Children with long-term physical health conditions tend to have higher prevalence of mental health problems, and also children who've experienced, you know, really extreme adverse circumstances. So that teddy bear there is one left behind in a refugee camp after those that were living there had to leave very quickly. And I suppose what we notice about these risk factors is some of those, we can sort of spread them across this wider ecological system for children and young people. Some of them are, you know, very much part of the individual's kind of experience, but others are more in the immediate environment, the school or the family, and others are much more to do with the wider context. And the other thing we know about risk factors is one thing that predicts the presence of a risk factor is another risk factor. So they will tend to cluster together. And the concern there is that, well, I mean, I can give an example, I suppose. So if there are, if you have money struggles and are living in poverty, that's also likely to increase pressure on the family and probably increase conflict. It also probably means you're more likely to live in an area that might feel more unsafe. And it also may put pressure on the family such that parents experience quite severe stress too. So you can see how these things start to co-occur, and where they really sort of start to stack up, that's where young people really exhaust their capacity to cope. So I've stuck with risk factors for a while. I feel I should sort of bring us to something a bit more positive. So the flip side of that then becomes, what are the sort of protective factors that exist that are potentially available for young people to draw on before we even think about interventions? Michael Ungar has noted a few, and I just think it's a nice way of sort of giving a bit of a tour through common protective factors. So one is about structure. I think this was something that young people really struggle with over lockdown. Structure and routine, something being predictable, robust, secure. Consequences again, but that's about predictability. So having a clear sense of what is and isn't acceptable behaviour, probably more important in younger children, but obviously still relevant with the older ones. Positive and warm parent-child connections, but also lots of wider connections, so wider family connections, but also peer relationships and relationships with others in school and in the community. A really strong and positive sense of identity, good sense of control and self-control, and I'd probably add in there as well emotion regulation. Sense of belonging, culturally, spiritually, and having a sort of sense of purpose. Feeling like there's a sort of a role, having rights, having recognition of that and responsibilities, and also, of course, feeling safe and feeling supported. So again, I'd just like to come back to how young people have described this in their own words. So from the same interviews, we had a number of themes that came out about the support that young people could access from others around them. They talked a lot about adults at home being a source of support, although they sometimes said there were conflicts and challenges, but that they would turn to parents for help. They talked about brothers and sisters, sometimes again being a challenge, but actually talked a lot about supportive sibling relationships. They talked about teachers being a support, but they did feel that sometimes their relationships with teachers, particularly those who were who were experiencing a range of challenges, especially behavioural ones, felt that sometimes they didn't have teachers on side enough for that to feel like a supportive relationship. But when it was there, it was someone they would really turn to, which is what I mentioned previously as well, of course. Friends definitely being that source of support. And also pets, which I didn't expect to come out, but pets came out really strongly as a non-judgmental and consistent source of support, which sort of makes sense. But it was also really clear from these interviews that sometimes help wasn't consistent or didn't feel reliable, or that sometimes it was hard to come by. Lots of young people talked about what they would do themselves, so sort of self-care strategies, if you like. They talked about trying to put a positive spin on things if things have been difficult. They talked about engaging in sports, reading, creative activities, sort of distraction, if you like. They talked about treats and self-rewarding chocolate, that kind of thing. And they also talked about using their phone to play, but to sort of socially game and also to interact with their friends as well. They also talked about some other strategies that I think there's a real question mark over whether these things really help, but they talked about things like trying to ignore problems or trying to sort of suppress them so they didn't keep sort of, rearing their ugly head. And they talked about trying to look at the problem a different way and understand it, but sometimes that did edge into sort of potentially ruminating over problems excessively. And there was some discussion of sort of managing certainly social challenges by defending themselves, and sometimes that felt like maybe empowerment and standing their ground, but other times it definitely spilled over into quite negative physical interaction, so that being somewhat problematic. I just wanted to bring these together because I think it feels sometimes like there's a really simple relationship between, okay, if you've got risk factors, you add protective factors on this side, and then that will make, the net gain is the thing we're looking for, and that's great. But it's a really tricky relationship between the two things. So I think another thing that we did with this data was to try and pull it apart and say, can we discern different sort of constellations of risk and protective factors in these groups of young people, and what does that tell us about their experience and how they draw on supports around them? So one group that came out really strongly we called multiple sources of support, and they were doing pretty well. They didn't seem to have many risk factors, many challenges that they were trying to tackle, and their well-being was generally pretty good. And they talked about having lots of different supports in place that were quite consistent. So family members, they definitely felt confident they could turn to. They felt that school was a positive space that gave them support, and they could definitely go to teachers and others within that environment. They talked about having multiple friendships which were consistent and that they could trust and rely on. And they could name others within the community that they could also draw on. So it could be faith leaders or youth workers or others. And they tended to be coping quite well, perhaps unsurprisingly based on that description. But a really interesting group who we called self-initiated forms of support, and that group seemed to have more kind of risks and things they were trying to manage, but they very much talked about being quite self-contained in the way they coped with those things. So they did talk about family members and friends, but not so much as they talked about those self-managing strategies, the trying not to think about things or trying to understand them different ways, or basically just, what can I do myself that will help me cope in this situation? And they weren't coping so well as the first group, but they were kind of doing okay. I suppose this group might be, if we think of resilience as grit and some of those other terms that make it sound like an individual quality, this group might look really good. But I have a bit of a question mark about that group. If the hard knocks of life come, do they have enough there just from relying on themselves to be able to sort of manage those challenges? And the last group were the group that really stick with me, I think, because we call them uncertain sources of support. And this group tended to be managing quite a lot of risks and quite a lot of challenges. And they talked about having some supports. It's not that they didn't talk about these things, but when they talked about them, it tended to be a bit of a double-edged sword. So they talk about family members who were supportive, but sometimes actually were quite, they felt threatened by or worried about, or they might have a slightly fractured relationship with. So they might really get on with their dad, but their dad's in prison, for example. Or they might really liked to rely on friends, but often their friendship groups broke apart and then reconstituted, and they were never really sure where they were with it all. Or that they would like to draw on school, but they didn't have great relationships with teachers. So it really, yeah, and this group were also quite strong on features of those coping strategies that we felt were sort of maybe not so helpful. And my sense with that group is really that they're just in they're in very challenging circumstances. So it's not that they wouldn't draw on more robust sources of support, it's that that's really what they have. That's what's in their kit bag. So that's what they draw on. So that they're really struggling with that. And it's not really down to them to have agency to go out there and get that extra help. It's just not in their environment. And so just as a kind of a bring that all together, I hope what I've said so far is that mental health challenges are actually more common than we think they are. They've been going up, but actually across the lifespan, it's kind of a normal experience. Yeah, obviously severe mental health problems have implications for later life, but there's a whole range of social conditions, experiences that put young people at risk, and where those risk factors cluster, the ability to adapt to function well is really diminished. And protective factors, yes, really good to put in that space, but the reality is for some young people, they're quite hard to come by, and the relationship between risk and protective factors is quite complicated. So the question then becomes, how do we put something in place that acknowledges all of that complexity, I suppose? How can we bear in mind those young people who really might not have other things to draw on? So how do we put things in the school setting that will really help them out, that will do that thing that we were saying at the beginning, which is to equip them for when those sort of hard knocks come their way? So the solutions need to think about normalising the discussion of mental health, absolutely along the lines that I mentioned earlier, to think about fostering those social emotional skills, but they also need to reflect the complexity of the problem. So, I mean, there's a lot of evidence to suggest that schools is a good place to start. That, of course, from a sort of public health perspective, they are a universal access point for most children and young people. And as I said earlier, we can see that young people will commonly turn to teachers and others in school for support for their mental health. Schools potentially should be interested because positive well-being and good mental health does predict good outcomes in later life. And if a school's not, if a school's for anything, hopefully it's for good outcomes for children and young people in later life. And there's fairly good evidence that intervention in school does improve mental health. I say fairly good evidence because it's still a bit limited. We did a review a couple of years back now for Public Health England, which was more just universal interventions generally. And what we found was the evidence is quite patchy. There were a small number of programs that repeatedly came out as sort of having promising practice or early evidence of effectiveness, if you like. And there were a few common elements that stuck out. So yes, definitely things that were provided in schools, things that were in group settings and had a sort of planned set of sessions. So, might be 30 minutes, an hour over a series of weeks. They were quite often skills-based or based on cognitive behavioural principles. And they were designed to be engaging, which sounds obvious, but if you see some of the interventions that have been designed, not all of them are, unfortunately. So when I say designed to be engaging, they were much about role play, discussion, really thinking about how they got young people engaged with the material rather than just sort of taught sessions necessarily. We've had a more recent review that came out a couple of months ago from the Early Intervention Foundation, and again came out with similar findings. There is good evidence for social emotional learning interventions and cognitive behavioural programs and some bullying interventions, but just generally patchy literature out there and a number of gaps that they noted. So one was knowledge about implementation and what that means. So what happens when an intervention's used but it doesn't get fully rolled out or it's not quite delivered as intended? We don't really know enough about that. We don't know enough about the long-term effects. That's often neglected in the research literature. We get 3-month follow-ups, but we have no idea whether that lasts in the life of the young person. Generally, we just don't know enough about the range of approaches out there. Schools get approached all the time with bright, shiny interventions to use with young people for mental health. Very few of them have an evidence base. Quite often they'll say evidence informed or something like that. And just not enough time spent thinking about, does this intervention fit this context? Yeah, and I think in terms of what happens in practice, there are problems about, the way implementation happens. I won't say much about this because I'm just conscious of time, but essentially when we talk to schools about what they do, they quite often don't go for the evidence-based thing necessarily. They will go for borrowing practice from a local school who's works in a similar context and they found something to be really positive. In ways, there's no bad thing about that. It's very helpful to know that something's worked in a similar context, but it's also good to know from a slightly more objective standpoint that it works. And we also know that within schools, things tend to get adapted. And what does that really mean for effectiveness? I mean, it makes sense to adapt something to the context, but we really don't know that sweet spot between changing something enough to make it fit and changing it too much so that it doesn't work anymore. So just to say, we're carrying out a couple of trials at the moment, which I hope will begin to plug some of those gaps. So I think we definitely need more of these. So one of them is about, the AWARE project is about taking interventions that have been used elsewhere in the world and bringing them to the UK schools context and saying, what do we need to adapt here? But also, can we roll these out and show that they work in a UK context? Because we really don't know at this point in time. And then the second one, called Inspire, is much more about these sort of more like the principles and practices that schools will use routinely themselves. So can we take these sort of more light touch interventions like mini sessions of mindfulness or relaxation and see that if we create a bit of, a more systematic way of applying them, do they actually benefit children and people? So in that first trial, we're trying 2 different interventions. I won't say much about them, but you can just see from the descriptions on there, they fit really into that category I was mentioning about these quite planned and, uniformly delivered interventions that fit in the school context. And they have been tried and tested elsewhere and found empirically to work. And then these other ones are much more based on school practices. So as I said, 5 minutes of relaxation a day is one of the interventions, and the other one's around mindfulness-based skills. And then we have another one which is around strategies for supporting well-being, essentially. So thinking about support networks and knowing when your mental health is struggling and when it's actually just more the pitch and thrust of daily life. So those trials are still ongoing. But what we've been able to do as part of those is build in a really strong implementation monitoring aspect. We're really lucky to have a pilot period where we could co-refine some of those interventions with school staff to make sure they really fitted before we rolled them out. But what we can discern so far is a few things. So definitely we had to make adaptations even to those evidence-based approaches because they've been designed for very different school systems and just didn't really fit. So that was really important. Even then, when they've been adapted, school contexts just vary so much one to the other. So not everything fits everybody. And probably partly as a result of that, adaptation happens in schools. You'll think something, we definitely said this is 6 sessions of this, an hour each, and then you'll find out, oh, we did it 12 sessions in half an hour each, or we did it all in 1 week. So yeah, adaptation just happens as you go. And the sustainability, so how much people really stick with these approaches just varies hugely from one school to the next. The other thing I think we find is that variability is quite often driven by what else is happening in the school, and that these interventions don't really work well in a vacuum. So the way I would describe that is interventions actually is where a lot of our research focus goes. We think, okay, what can we put in place at 6 sessions of something must fix mental health problems, and that's the assumption underlying much of the way we do this research, but it's really just the top of the iceberg. And the school system is so much more complex, just like the whole ecosystem around the young people is so much more complex. So what else is there that we need to think about? Well, so there's one about, we have that universal layer, of course, but then we also need to know who is it that really needs help. We don't have good mechanisms for working that out at the moment, but certainly something that schools have been thinking about more and more, especially during the pandemic. Wider school-based wellbeing promotion, I think, is crucial. So part of that is about that normalizing language and about, mental health being everybody's business, all of that kind of thing. And certainly within English schools at the moment, there's been an expanding of the personal, social and health curriculum to include mental health to kind of give that message. But there's also something about those other factors I mentioned earlier, that sometimes the school environment feels like it's set up to undermine young people's well-being. It's eroding, the narrowing of curriculums, the eroding of break times, the high stakes testing. So it's not just what can we put in, but what can we take out, or how can we tailor this and listen to young people and hear that this is not an environment that's good for mental health. It might be geared towards getting good exam results, but at what cost to the young people? And I suppose that does relate to school leadership and management. So part of that is about this needs to be led from the front, but it needs to be embedded strategically within school structures and systems and processes. Oh, what two at once? It also is about reaching out to parents and carers, because of course there's the context outside the school. It's good for parents to know, and then they can reinforce these messages at home. But it's also just part of kind of trying to ensure the home environment has that same kind of ethos to it. Of course, it's about listening to young people, understanding from their perspective what those challenges might be. And it's about equipping staff to do this, because quite often when I talk to teachers, they say, I teach maths, I don't know anything about mental health, I don't feel equipped for these conversations. I see young people struggling, but I don't know how to help. So it's about giving them the confidence to have those conversations and the knowledge to know who to send them, who to sort of pass those young people on to if they need extra help. Where is that sort of that pathway to more support? And of course, it's about linking to the wider system and how the school works with those external agencies, so not just specialist mental health support, but also all those voluntary sector organisations and all those other, all those creative activities that happen in the community and things. How do they fit into this bigger picture? And of course, it's about warm and supportive relationships. I think often when teachers say to us, we don't know what to say, the answer is, actually just being one of those protective factors in that environment for young people. One is never enough, but being part of that wider fabric of support is really important. So you don't have to be a mental health expert. That is for somebody else to do. But what is really helpful is that young person feels they can talk to you, feels that you're there with their interests at heart. Okay, so that's a bit of a whistle-stop tour. I think that last bit is really sort of trying to speak to, sorry, I'll just go back to it quickly, is trying to speak to that whole school approach. I think, again, this is where the research falls down a little bit. We've got some evidence to suggest this kind of much more embedded approach is more effective, but we don't have brilliant amounts of evaluation and research in this area that tells us what a really, really good whole school approach looks like. So there's a few things for us to think about. So building the evidence base for all of these kinds of interventions, but especially for whole school approaches, is really important. Thinking about just monitoring implementation should be routine. It shouldn't be missing from any trials or evaluations. It should be part of what we need to understand. Long-term effects, again, just the lack of any of that in the research literature really needs to be addressed. But also differential impact. And I think this is something I'd really like to focus on more. We don't really spend enough time thinking about, we think about whether interventions work on the whole. And my worry with that is they probably work really well for some young people and not for others. And who are the groups that we're missing? And I probably suspect we're routinely missing, and that because these interventions don't really suit them. And do we really understand enough about what would suit them? And I think that's something really important. And also just how this fits into the wider system. So I talked about all those risk and protective factors, not just being in schools, but being right across that whole ecological system, and how we embed that kind of support in the same way, I think is really important to consider. Great, that's it from me in terms of going through the slides, but yeah, really interested to hear people's questions.
Yeah, that was amazing, Professor Deighton. Just like to thank you, first of all, for that. It was really wide-ranging, illustrative, but also quite accessible as well. For me, as someone who wouldn't have a background necessarily in psychology, so really, really enjoyed it. So I have been keeping an eye on the chat function, and I'd just like to remind individuals, if you'd like to use it, you're more than welcome to as well. So one question that popped up here relating to kind of, I guess, earlier on in the talk was revolving around if we're saying that most people develop a diagnosable disorder, does this say more about our expectations about normal human experience than it tells us about the specific supports and needs of young people in this context?
Yeah, I mean, I think that's probably right. It tells us that is probably everyone's experience. I mean, I was sort of quite interested when I read this paper, and I thought to myself, and does that feel right? That feels really not what I expect from the research, but actually, if I apply that to myself, I think, yeah, there are probably times actually where I would have definitely hit above the threshold on something because things were just really tough. And I think that in a way that should be our expectation. I suppose what I'm not saying is that doesn't mean that every person who scores above a threshold needs a specialist service. And I think sometimes we talk about this gap between the support that's available and the need. And there is definitely a gap, and I'm not trying to detract from that. But I'm not sure, if we say only a quarter accessing specialist help, 3/4 aren't. Some of those might be getting loads of support from friends and family, and they're mental health isn't great, but they're managing it like anyone might manage a long-term condition. Or they might be getting really good support in the school, or there might be something else. So I think there are just ways that people manage, and that's right. And I think that is part of the human experience to a degree. But of course, it doesn't mean that we don't try and put supports in place when it happens, but that should just be part of the course of the way we do things, I think. So yeah, it is a different perspective.
Super. We have another question here in relation to teachers. So this person's wondering, do you have any particular thoughts on how to embed she's talking about the insight you had about tailoring, removing pressures, as well as these interventions. And they're wondering if you have any particular thoughts on how to embed this strategically across different stakeholders, with particular reference to teachers, because teachers often experience that they're under considerable personal pressures in conjunction with this.
Yeah, so I maybe there's two things there. So one is, I think quite often the mental health strategy for schools sits separate from the curriculum building and that kind of thing. So I think it's trying to build that consideration into the structures essentially. So each time a sort of policy or a strategy is developed, that should be part of the consideration. And so what are the unintended consequences for children and young people? And I think one of the really good ways to do that is just make sure you've got a really strong student voice. I think that's where that's really important. And what I mean by that is not just, a good, I can't remember what you call them now, student panel or whatever it is, because quite often they're the very articulate, the very ambitious, the very motivated group of young people. And you quite often miss the ones who are the ones really struggling. So it's about making sure you've got that cross section and asking them what they think the challenges are and the problems and how things need to change. Because often it's really hard for us to get our head around the solution. And I suppose the bit about teachers, I really hear that. Teachers have had a massively stressful period of time. I mean, teaching was already quite stressful. There was already quite a lot of job churn. I don't know if it's the same in Ireland, but certainly in the UK, we had awful rates of job churn in teachers. And the pandemic has just made their job 10 times more complicated. And they're seeing young people day in, day out with massive, massive problems. And they take those problems home and they worry about them. The teachers, that's the nature of their role, and why they're in the job is they really internalize those worries and they worry for those young people. So I think thinking about how staff wellbeing can be at the centre is really important. And anyone who's interested, the Anna Freud Centre has a whole area of materials around called Schools in Mind, is a network that you can join, which is just people interested in mental health in schools. But there's a whole load of materials around teacher wellbeing and how you think about that, from wellbeing activities to providing supervision space and peer reflection space and that kind of thing. So lots of ideas.
Super. I have another question here. Wondering, is there any really successful programs to support advocacy and in particular signposting to available supports in schools?
I'm sort of struggling to think how that would work without it being specific to the school, if you know what I mean, because it sort of depends on what's on offer. But certainly one of those interventions we're testing that I mentioned very briefly is called Strategies for Safety and Wellbeing. And what we've been trying to do with young people there is to get them to think about where their support systems are. And I think, so the reason I'm pointing to my fingers is there's an activity they do where they have a hand and they write each of their supports on the fingers. Just realised I was doing that without thinking about it. So there are techniques like that where you can get young people to think through that. And as part of that, the school can embed, well, let's map onto this, where all our school supports are in our school and what else is in the local system. But I'm struggling to come up with a sort of off the shelf kind of example, if that makes sense.
Well, that makes perfect sense. I have another question here, wondering how we can increase or foster partnership between parents, schools, and other mental health agencies.
Yeah, it's a really good question. It's not, well, it speaks to the same kind of trying to work across different agencies and stuff. In England, we've had something called the LINK program, which is about linking, oh gosh, I don't know the infrastructure in Ireland, but linking what we call CCGs, that basically like the health sector people, the education sector people, and trying to get them to work much more closely together, because there's often a lot of discussion about how people get referred to specialist services and schools not quite doing it right from the perspective of the health professionals, and schools feeling really frustrated and things just get knocked back. And yeah, so trying to get that to work much better. So I think those kind of models that actually actively bring those different agencies together in a space is really helpful. We've just been doing a really interesting project, it's just starting off, but it's very much a place-based approach, and it's about monitoring wellbeing in secondary schools the whole way across the Greater Manchester Combined Authority. So it's quite a big region, and they're all signed up to the same thing, and it's going to give them data about how the mental health and wellbeing of their young people is. And we've got voluntary sector organisations, health, public health, education professionals, and they are all reviewing the data together and coming up with their own solutions about what that means for support, and that's giving them space to do that. So I think being able to pull those conversations together and sort of galvanise all those groups is really important. It's quite hard to get off the ground, I appreciate, but I think that's the way to do it.
Thank you, Jessica, for a really interesting talk. And thank you to everyone who has attended. Unfortunately, we're out of time for today, but I hope you enjoyed our research webinar series. If anyone's interested in viewing the talks, you'll be able to find them on the YouLEAD website. Thank you, everyone.
Thanks.
Bye.